Hello, this is Rashawn Hoover, studying at Kaiser University, taking health psychology with Professor Esterling, a biopsychosocial review of sleep disorders. Introduction. This presentation explores sleep disorders through the biopsychosocial lens, looking at how biological and psychological and social factors all play a part. This presentation will cover causes and risk factors, types of sleep disorders, assessments, and treatment. What is normal sleep? Sleep is critical for the body and mind. Poor sleep increases risk for cardiovascular disease, obesity, mood disorders, and cognitive defects. This presentation will review causes, factors, assessments, and treatments for biopsychosocial perspective. You have cycles, functions, and durations in your sleep. Next slide. What are sleep disorders? Some common types are insomnia, sleep apnea, narcolepsy, restless leg syndrome. Normal sleep cycles alternate between NREM and REM. Deep NREM helps physical restoration, while REM supports learning and emotional health. Insufficient sleep disrupts these processes. The definition will be persistent disruption in sleep patterns affecting health. Next slide. Sleep disorders arise from biological, sociological, and social factors. Examples such as genetics, stress, lifestyle, and environment. Most sleep disorders result from complex interactions between biological, sociological, and social context. For example, genetic predisposition may interact with chronic stress or shift work to produce insomnia. Biological factors. Genetic influence sleep patterns and disorders. Medical conditions, hormonal imbalances. Biological factors include inherited traits, physical health conditions, and hormonal regulation. Sleep apnea is often linked to obesity, while stress hormones can disrupt sleep onset. Next slide. Psychological factors. Stress, anxiety, depression, increased sleep disruption, cognitive distortions. Mental health is closely linked to sleep, chronic stress, and anxiety active the HPA axis, raising cortisol, interfering with both falling and staying asleep. Next slide. Social and environmental factors include work schedules, shift work and long hours, environment, noise, light, bedroom comfort, social pressures such as lifestyle, cultural norms about sleep. Social context shapes sleep quality. Shift work, technology use at night, and cultural attitudes towards sleep all influence the development of sleep disorders. Assessment instructions. Pittsburgh Sleep Quality Index, PCQI, evaluates sleep quality and disturbances. Epworth Sleeplessness Scale, ESS, measures daytime sleeplessness. Data informs diagnosis and treatment planning. Reliable assessment tools like the PSQI allow clinicians to quantify sleep quality and patterns. These tools provide evidence for treatment decisions and track patient progress. Next slide. Evidence-based treatments. Cognitive behavioral therapy for insomnia, CBTI, improves sleep efficiency and reduces worry. Continuous positive airway pressure, CPAP, standard for obstructive sleep apnea. Lifestyle interventions, regular schedule, reduce caffeine, exercise. Treatments combine behavioral and medical strategies. CBTI is highly effective for insomnia, while CPAP improves apnea-related breathing issues. Lifestyle changes complement clinical interventions. Insomnia. Definition: difficulty falling asleep or staying asleep. Nights, week, for less than 3 months. Types of insomnia: acute versus chronic. Contributing factors: stress, anxiety, and irregular schedules. Insomnia is the most common sleep disorder. Chronic insomnia affects mental health, cognition, and overall quality of life. Acute insomnia often results from short-term stress, while chronic insomnia can be maintained by maladaptive sleep habits. Next slide. Sleep apnea. Obstructive sleep apnea. OSA. Airway obstruction during sleep. Symptoms: loud snoring, daytime sleepiness, fragmented sleep. Risk factors: obesity, age, male gender. Sleep apnea interrupts normal sleep cycles, leading to fragmented rest and excessive daytime sleepiness. Untreated OSA is associated with cardiovascular disease, hypertension, and metabolic dysfunction. Next slide. Narcolepsy. Chronic neurological disorder causing excessive daytime sleepiness and sudden sleep attacks. Often accompanied by cataplexy, hallucinations, sleep paralysis, linked to hypocreatine deficiency. Narcolepsy disrupts normal wake-sleep regulation. Hypocreatine deficiency impairs alertnesses and patients may experience hallucinations and or sudden loss of muscle tone, affecting daily function. Next slide. Restless leg syndrome, RLS, Urge to move legs during rest, often nighttime, causes sleep onset delay and fragmented sleep, may be linked to iron deficiency and neurological issues. RSL causes significant discomfort at night, reducing total sleep time and quality. Treatment includes iron supplementation and dopaminergic medication, combined with lifestyle medications. Next slide. Biological interventions: medication, hypnotics, melatonin, stimulants, CPAP for obstructive sleep apnea, light therapy, adjust circadian rhythms. Sorry, I have a hard time pronouncing that word. Biological interventions target Biological interventions target physiological causes. CPAP is standard for OSA, while melatonin and light therapy help regulate circadian sleep-wake cycles. Medication should be short-term or targeted for biological interventions. Next slide. Psychological. interventions. CBTI addresses dysfunctional thoughts about sleep, relaxation training, deep breathing, progressiveness, muscle relaxation. Mindfulness based therapy reduces hypoarousal and rumination. CBTI is the first line treatment for chronic insomnia. Relaxation and mindfulness strategies reduce physiological arousal and anxiety, improving sleep onset and maintenance. Next slide. Social environmental interventions. Consistent sleep schedule and bedtime routine. Reduce screen time before bed. Quiet, dark, comfortable sleep environment. Social and environmental changes help reinforce healthy sleep habits. Controlling light, noise, and electronic use strengthens circadian rhythms and improves sleep quality. Next slide. Integrative biopsychosocial approach. Combine biological, psychological, and social interventions. Example: CBTI, CPAP, sleep hygiene, education. The biopsychosocial model encourages comprehensive treatment, combining medical devices, therapy, and lifestyle adjustments, ensures sustainable improvements in sleep quality and overall health. Next slide. Importance of sleep health. Reduces risk for obesity, diabetes, hypertension. Supports cognitive performance and emotional regulation. Enhances immune function and overall quality of life. Good sleep is essential for physical and mental health. Chronic sleep disruption increases risk for multiple chronic diseases and decreases daily function. Public health strategies should emphasize sleep promotion. Next slide. Key takeaways. Sleep disorders are multifactorial: biological, psychological, and social. Evidence-based treatments: CBTI, CPAP, lifestyle interventions. Assessment instruments like PSQI are vital for targeted care. Biopsychosocial approaches improve outcomes and prevent relapse. In conclusion, sleep disorders require a holistic approach, combining assessments, medical treatment, behavior therapy, and lifestyle modification ensures the best outcomes. Sleep health is essential for well-being, making education and intervention a public health priority. As a final thought, healthy sleep is not a luxury. It's the true foundation of a healthy life. Thank you very much, class, professors, for your time. These are my references listed here below. Thank you again.